So Brent, what are some of the things, especially because of your role, as the Associate Dean for Rural Health Innovation, right? What is your perspective on how do we advance consumerism with also being mindful of some of the social determinants and some of the inequities there?
I think if you're going to advance consumerism, I think, how people will adopt technology has to be a thought there, and meeting them where they are. I was in an hour-long phone call yesterday, and we were talking about apps, and we were talking about, the adoption of apps and whether or not people had the pathway or the technology even to start in that app process. And I think that we have to look at, when we talk about adoption in high need populations, rural area. I have a lot of experience. I've grown up and I practice, and my career is dedicated to rural populations. But, I would encourage people to say not just rural, but disadvantaged or disparate or low resource population. And you can be a low resource population in a metropolitan area. So I think that when you start thinking about innovation and consumerism, you need to think maybe about least common denominators or pathways or adoption or efficiencies in how you do the workflow. I've been a victim as a physician of so many bad workflows through technology that have been brought in, and people say, oh, this is a great technology. It does something great, but it's going to cost you a half an hour to an hour extra a day, or it's going to cost your staff more time. People don't understand how 30 seconds, adds up when you have to do that 30 seconds, extra 30 seconds, 20 times a day, 30 times a day, 40 times a day. There's a lot of administrative burden there. Patients have stress in their lives. And I think that's something that people are going to have to understand, whether it's a social determinant evaluation, whether it's a mental health evaluation, and how we meet those patients where we are. We're really the drive to me in all of this is precision. And I'm not talking about precision genomics, but I think about precision education based on the individual patient. The data pools are so rich now, but in healthcare, we're just not driving them toward the individual patient's benefit.